Guys, here's your D for you. D talks about medical schools teaching teaching students about end of life care and death and dying. So we will get into the presentation I made for you tonight. Sit back and please enjoy. Okay. Scope of the review. A team of researchers at Washington State University conducted a systematic review of 43 published papers spanning from 2013 onward that examined how U.S. medical schools approach teaching about death, dying, and end of life care. This broad sweep of the lecture was intended to capture both the strengths and weaknesses of current educational practices. Core finding: the review concluded that medical students receive little or no formal standardized training in guiding patients and families through end of life issues, where instruction does exist. It is highly viable across institutions, often treated as an elective or supplemental topic rather than a core competency. Okay. Quality of evidence. Most of the students reviewed relied on low rigor designs, short interventions, and limited follow-up, and weak assessment methods. These approaches tend to emphasize information delivery, lectures, brief workshops, rather than sustained skill building or robust evaluation of communication outcomes. Communication gaps. The review found minimal evidence-based education on how to conduct difficult conversations about prognosis, goals of care, or emotional support. Students are rarely taught structured frameworks for discussing death with patients and families, leaving them unprepared for the realities of clinical practice. Timing of comfort and death, or with death. Timing of comfort with death. A recurring theme was that students only become comfortable handling death and end of life conversations once they are already practicing physicians. This means they encounter these emotionally charged situations without adequate preparation during their formative training years. Barriers noted. The page highlights systematic obstacles, including the dominance of standardized testing in medical education because communication skills are difficult to measure with multiple choice exams. Schools often sideline end of life training in favor of test driven content. Who led the work and where was and where it was published, authors and affiliation. The compounding author is Raven Weaver, an associate professor at Washington State University. The lead author is Logan Peterson, a recent WSU medical graduate now in residency, who emphasized the importance of preparing doctors for cancer-related end-of-life decisions. Publication. The findings were published in the journal Academic Medicine, a leading outlet for research on medical education. Why the page says this matters. Impact on patients and clinicians. The article underscores that better timing can reduce fear around death or patients, families, and clinicians alike. While preferred, doctors are more capable of guiding patients through end-of-life decisions with compassion and clarity. Improving quality of care and reducing distress. Systematic gap in education. The review points to a significant gap in medical education. While death is a universal and inevitable part of healthcare, it's not consistently or rigorously taught. Call to action implied. The page suggests that classroom-based, evidence-driven training could help students build comfort and competence before they face these situations in practice by reframing end-of-life care as a core skill rather than an optional topic. Medical schools could better prepare future physicians for one of the most challenging aspects of their profession. In essence, the page highlights a paradox. Death is central to medicine, yet medical education often treats it as a peripheral parallel. The study calls for a cultural and curricular shift to ensure that doctors are trained not only to treat disease but also guide patients and families through the profound human experience of dying. Okay, guys. So, those are your shows for now. I might jump back on and do an extra one in a little while. But for now, I'm going to take a break. I will see everybody shortly. For now, Gator Wellness, take care, folks.